3 Army Reserve officers were disciplined for dereliction of duty following a rampage in which fellow reservist Robert Card killed 18 people in Lewiston last fall. Good evening, everyone. I'm Brian Yacono.
And I'm Amanda Hill. Those 3 officers were not identified in a new report from the Army, which cited communication failures within the chain of command and between military and civilian hospitals in dealing with Card in the months leading up to the shooting.
News and Maine's Chris Costa has gone over that report and questioned military officials about it. He joins us live in the studio with the details. Chris.
Brian and Amanda, Army Reserve Lieutenant General Jody Daniels says the Army is already implementing changes from this report. It also reveals that the people closest to Robert Card noticed his mental decline as early as 10 months before the shooting. Investigators say there was abundant evidence that Card was a threat to himself and others, and that his fellow soldiers and medical staff knew he should not have access to any weapons.
And the tragic events that unfolded in Lewiston, Maine have shaken us all.
Army Reserve leaders point to a slew of failures, from its officers to its medical providers and even Maine law enforcement. The Army's own investigation found the biggest problem was a failure to communicate.
There was a lack of communication between medical facility staff and Card's unit leadership.
Card needed more advanced psychiatric care. That's why last summer in New York, Army staff transferred him from a military hospital to Four Winds Hospital, a civilian hospital, which says it specializes in that type of treatment. The investigation says medical staff there found Card had homicidal ideations, including a hit list. The first time any medical provider noted this was 3 months before the Lewiston attack. But hospital staff discharged Card after 19 days, saying at the time he was not an immediate risk. The investigation found there was no follow-up plan, despite the hospital's recommendation that Card should not have access to any weapons, even his personal ones.
The information was not passed on to his chain of command.
Army leaders also say Card's fellow soldiers failed on several fronts. They did not follow protocol that would have kept Card in medical care. They did not follow up with Card after his release from Four Winds. They did not know how much medical info they were allowed to ask for to understand his risk. All actions they could have and should have taken.
So there was a lot of administrative things that did not take place that they should have known how to do. Behavioral health professionals released him and said that he was low threat. One would make the logical assumption that he was okay to go back out into the civilian environment.
Right. But the family was supposed to take care of all the weapons and move it.
Another breakdown involved Maine local law enforcement.
Those folks did the right thing in contacting local law enforcement. They had no other authorities to do anything at that point.
The report says Saginaw County Sheriff's deputies had enough information about Card's declining mental health and access to weapons based on the letter from fellow soldier and best friend Sean Hodgson. In that letter, Hodgson warned Card could snap and commit a mass shooting. The investigator says the deputies should have requested more backup during the last welfare check and, quote, had they taken Card into custody that day, they likely would have been able to invoke Maine's yellow flag law. But deputies have told us that was not possible under Maine's law at the time, and that they had a plan for Card's family to take the guns away.
How do you start the yellow flag process when you can't physically put your hand on somebody's arm and say, you got to come with me to the hospital, you're in protective custody? There was no legal mechanism for me to do that at that period of time.
And we reached out to Four Winds Hospital for comment. We've not yet heard back. Lieutenant General Daniels said the Army cannot compel the staff at Four Winds to cooperate with the investigation, but she did not have a reason why. The Army's trying to decide whether to keep contracting with that hospital. In the meantime, Brian and Amanda, the Army has updated some of its policies. One instance involves medical staff. They tried to reach Card multiple times, but Card never answered, so those staff closed out his case. Now, they will no longer simply close out a case if a soldier refuses to make contact.
Chris Costa live in the studio. Our thanks to you.